Hello everybody, thank you so much for being on my channel. Today I'm Dr. Perkins, a board certified OBGYN, and today we're talking about, can bacterial vaginosis feel like a UTI? BV, UTI, which one is it? I know sometimes the symptoms can be so similar that it can leave you feeling confused, and so that's why we're here today. We're going to talk about what exactly is bacterial vaginosis or BV, and what exactly is a UTI, and how do we truly distinguish between the two? We'll also talk about what happens if you treat for the wrong infection, and when do you contact your doctor for more testing and information, for more testing and treatment. All right, so let's dive into this topic today. Hi, thank you again for being here. Bacterial vaginosis is such a common infection in females. Bacterial vaginosis is an infection that isn't caused by a bacteria that is native. It's not caused by a bacteria that is new to your body. It is actually caused by a bacteria that lives in the vaginal space all the time. It is always there. It's actually supposed to be there. In the normal amounts, it actually helps to protect the space from bad bacteria. So it's a really, really good thing. The problem is when this said bacteria grows way more than it's supposed to in your vaginal space. So if you think about it, if we are supposed to have 100 of this bacteria in the vagina, we may have 500. And so that creates an infection, and having that infection actually just throws off our complete vaginal microbiome, and it causes issues and symptoms like burning, changes in your vaginal discharge that can be gray or frothy-like, very thin and runny. Sometimes it may cause a really fishy odor, especially during sexual intercourse. The crazy part about it, though, is that a majority of people have no symptoms at all. And you can actually have this infection for many, many months or even years and be completely unaware of it. On the other hand, a UTI is a urinary tract infection. This is an infection that is not an infection of the vaginal space. I can't tell you how many patients actually confuse that. But the reason is because both systems are so close to each other that it's very easy to get them confused. A urinary tract infection is an infection of the urinary tract and anywhere along the line. And so if we were to think about this, the area where urine comes from is called the urethra. It is the tube that releases the urine from your bladder. The bladder then gets the urine from your kidneys. And there are two tubes called the ureters, one on each side, that actually drain the urine from your kidneys. And so when we think of the higher tier, like the top of the ladder here, we have the kidneys, the ureters drain the urine to the bladder releases the urine out the body through the urethra. An infection anywhere along those lines, like that pathway, can cause a UTI. A majority of people will feel that infection right about when that infection gets to the bladder. This is where bacteria starts to multiply, and process of multiplying causes pain and discomfort. You may feel like you're urinating all the time. You may have some burning when you urinate. These are the symptoms that are really common to a UTI. Now, people get confused between the two because sometimes you can have burning in both, or you may have some pelvic discomfort in both. Or maybe you have sexual discomfort. This can happen in both conditions. The difference between the two really lies in where are you feeling the symptoms, especially the burning. If you have burning specifically when you urinate, when the urine is exiting the body, you feel a lot of burning, but in between you have no burning, no sensations, no discomfort, that is likely a UTI. A bacterial vaginosis infection will not be an infection that causes burning with urination only. And so that is like one of the biggest things to look for to know or distinguish between the two. Another telltale sign that I would mention is that bacterial vaginosis usually causes a change in your discharge that I mentioned before, and a UTI will not. And so if you feel as though your discharge is increased, If you feel as though it is gray and runny and it's not normally like that, or you have that fishy odor that I mentioned earlier, that is a huge sign that this might be bacterial vaginosis and not a UTI. I mentioned earlier that bacterial vaginosis is extremely common. And when we think about the numbers, I mean, about nearly 30% of reproductive age females, that's between age 14 and say 49, may have BV or bacterial vaginosis at any point during that period of time. You may also have both a UTI and bacterial vaginosis at the same time. And actually, bacterial vaginosis may make you more susceptible to other infections like a UTI. And so even though most people don't have symptoms or they're not aware that this infection exists, it is really important because it makes it so much easier for you to get other UTIs. You can have other STIs, like sexually transmitted infections. You can have so many more infections because underlying you have bacterial vaginosis. Now, the treatment for a UTI is very different from bacterial vaginosis. Now, a UTI is caused by a bacteria that does not live within your system normally. It's not there to be protective of your urinary tract. It's usually caused by E. coli. Bacterial vaginosis is caused, again, by a bacteria that lives in your vaginal microbiome called Gardnerella. The treatments are so different that if you were to treat a UTI with those medicines, which are antibacterial, a BV infection will still exist, and vice versa. We cannot treat a UTI with medications from bacterial vaginosis. And so it is really important that we know exactly what we're treating before we start the treatment. In general, a UTI antibiotic course must be prescribed. Bacterial vaginosis, that treatment you can actually get over the counter. There are many different ways that we can go about treatment, but the best treatment is also an antibiotic. When we go to the doctor's office and we have these symptoms, usually testing is done specifically for your urine versus your vaginal discharge. And then based on what we find, we'll treat you appropriately. Now, if you think, well, I have antibiotics from another infection, I should just take it, I actually really recommend against that. I really truly recommend that you see your doctor for the appropriate testing and getting the appropriate antibiotics. With either infection, we don't want to have this infection linger in our system for months or years because they can lead to other possible sequelae later on in life. And so to avoid that, we want appropriate testing and appropriate treatment. Now let's talk about risk factors for both a UTI and BV. The first thing is douching. If you've been here on my channel, heard me talk about this a lot. And the reason is back in the days, okay, 30 years ago, 20, 30 years ago, people douched all the time, okay? And if you're just like, well, I don't know what that is, I'm glad you don't know, okay? Because I don't want you to know, because I don't want you to participate in this process. Essentially, douching means that we have a container that's filled with solution that you purchase over the counter, and you squirt this in the vaginal space in hopes to wash and clear the vagina of whatever normally lives there. And this is really bad for your vaginal microbiome because it increases the likelihood of having infections. It also increases the likelihood of getting bacterial vaginosis and a UTI. And so we let the vagina clean itself and we don't intervene with these solutions and products that are over the counter. The next risk factor for both of these infections is actually having multiple sexual partners. If we change partners in a short period of time, it is encouraged that you get testing, both for STDs, okay? And when we say STDs, the new term really is STIs, sexually transmitted infections, and so we'll use those terms interchangeably for now. But we want to be retested, and it's actually a good idea also to check the vaginal space and the vaginal discharge for a couple of reasons. The main one is that these infections can spread from person to person, and so they're not all sexually transmitted, but sexual activity can worsen it and we can exchange bacteria that way. And so again, a different video, different conversation, but if you'd like to learn more, check the link in our description below. Know that partners and having multiple partners and the likelihood of having unprotected intercourse increases the likelihood of having these infections. Also with sexual activity, we have a lot more movement of bacteria that can go from the rectum to the vagina to the urethra, and it increases the likelihood of having a UTI as well. The next that I'd like to mention is smoking. We don't really talk about this enough. Smoking affects all of our systems in our bodies. You may know this already, but I want to emphasize that today because specifically with both of these infections, smoking may increase the likelihood of getting them and recurrently experiencing the infections as well. On that note, recurrence both for BV and UTIs is actually quite common. So if you've had one, you're at a slightly increased risk of having another in the future. Now, I hope this information has all been helpful for you today. Thank you so much for listening in. As I mentioned a few minutes ago, I'd love to share a few additional videos that will help you to live your best life. And so if you're interested, please check the links below. Thanks for being here today, and I'll see you next time.